But in the meantime, it's MedPlus that's in focus. And we've got Madhukar Reddy, the Managing Director and CEO, now joining in. Thanks so much for taking time out. To begin with, the private label contribution has increased at about 14.4% in Q3. What has been the pharma versus non-pharma segmental growth?
For us, I think the pharma side grew a little bit. I don't have the exact split right now. I think it'll be in the call. But I think we grew by 1% in the pharma side.
And how can we look at your private label contribution increasing? What will be some of those growth drivers?
Okay. So as you know, we just launched the MedPlus private label brand, and we have actually introduced products that can take care of roughly around, now I think it's around 60 to 65% of all the therapeutic needs of our customers. So which basically means we have a substitute for almost that much number, right? Given the fact that our prices are 50 to 80% below the MRP versus a branded drug which costs, which is at around 20%, the delta in the cost is so big that we feel that customers will, take this up very, very enthusiastically, and this will continue to grow. It first around 5 months back. We have now launched it across the country, and we're seeing the same kind of response. An answer to the question, we feel that given the fact that the quality is same and the pricing is so much better, and we feel that more and more people will basically start buying private label medicines.
Okay. What is the outlook when it comes to your store addition that closed down versus the addition that was done each quarter in FY23? What's the guidance when it comes to your 800 to 1,000 stores for FY24? Are you confident of growing?
No, I don't think so. Actually, we're going to guide it to a 600 odd store level. And that is because of several reasons, actually. We decided that given the fact that we have a major new initiative this year, decided to go a little bit slow, hence the slight lower addition this year. We will, going forward, tell you what we're going to do next year. But yeah, this year, it will most likely be around 600 stores.
What about the traction in Diagnostic Segment? The loss in the third quarter has increased on a sequential basis, right? And you did guide to reach EBITDA break-even by Q4. Are you confident of that still?
I think we may still fall a little short of that Q4 break-even, and which basically means that we will not expand beyond Hyderabad, beyond the pilot region, which is Hyderabad for us. Although it is doing very well, I think a couple of things probably hit us this time. On the operational side, on the customer acquisition side, and on the store level, the diagnostics continues to do well. But I think the other expenses probably hit us a little bit out there. Again, detailed, this thing will be there in the earnings call later in the evening.
Right. And what's the expectation then when it comes to volume growth for you?
Volume growth on the pharma side looks very good. As I said, there is huge amount of traction in the states in which we have introduced the MedPlus brand. The early adopters have stepped in. We continue with our advertisement, and we continue with our, I would say, educating the public on some of the things which people usually have a misconception about. When we launched the drug out there and said that we are now giving a 50 to 80, some people basically struck it off saying that, oh, this is just another brand of another version of generic or something like that. Not realizing that almost everything in India is generic. It doesn't matter. You could put whatever name out there or not, but everything in India is generic. There's, out of our overall sales, around 7 to 10% is our actually patented drugs. So what we are educating the people right now, our customers and those in the cities in which we operate in, is that as long as the composition is same, which it is, all you need to really look at is the quality of manufacturing. And given that we are getting our drugs manufactured in the best facilities in the country, our quality is on par with everyone else out there. People are finding that argument, I would say,
Sure.
Yeah, and they are coming in to buy our stuff. So, yeah.
Right. I also wanted to understand when it comes to Diagnostic Segment in particular.
Diagnostics, obviously a discount of 75% is super attractive. So each of our 12 centers which we operate in Hyderabad right now are growing month on month. Don't have the exact numbers for you now, but we will, try and get them out in the call later in the day. But all I can tell you is every single one of our centers is growing month on month at a steady clip.
All right. Thank you for joining in and giving us that view. That's the outlook. So, yes, they have come down when it comes to the addition of the new stores, but private label sales are likely to grow from here on. 690 on MedPlus Health.